Good morning, everyone. I'm Dr. Ala Musbah, Professor of Obstetrics and the Gynecology Faculty of Medicine, Mansoura University. The topic of my lecture today about maternal and perinatal mortality. So what we wanted to discuss today, the definition of maternal mortality, the epidemiology, etiology, how to reduce maternal mortality, causes of declining maternal mortality over the past years. Then we are going to discuss the definition of perinatal mortality, the epidemiology of perinatal mortality and its causes, and how to reduce perinatal mortality. Let us start with our journey with the definition of maternal mortality, which is the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of duration and the site of pregnancy, from any cause related to or aggravated by the pregnancy or its management. Let us start to understand the definition. This is the maternal mortality, the death of pregnant lady during pregnancy or after delivery within 42 days, the period of puerperium is considered maternal mortality. And the causes of mortality may be related to pregnancy itself, direct causes, or aggravated by the pregnancy, like cardiac disease aggravated to become heart failure, or diabetes aggravated during pregnancy and diabetic ketoacidosis and the mortality happen. So the cause may be direct cause, like preeclampsia and eclampsia, for example, or indirect cause like heart disease or diabetes aggravated by the pregnancy. Also, the pregnancy may be intrauterine or extrauterine pregnancy like ectopic pregnancy. So, regardless, that's why in the definition, irrespective of the site of the pregnancy, and also irrespective of the duration of the pregnancy. So, at any time during a pregnancy or intrauterine or extrauterine. And the mortality may happen during pregnancy or after delivery in the period of puerperium within 42 days of delivery. Okay? This is the maternal mortality. There is late maternal death, expression called late maternal death. What does it mean? Any death that happen in women due to direct or indirect obstetric cause after 42 days of termination of pregnancy, but less than 1 year. That's why they call it late maternal death. So it is the after the period of puerperium, which is 42 days postpartum, but less than 1 year. They call it late maternal death. Let us understand the maternal mortality ratio and the maternal mortality rate. What is the maternal mortality ratio? The number of maternal deaths during a given time period per 100,000 live birth during the same time. Okay? So, this is the maternal mortality ratio. What about maternal mortality rate? It is the number of maternal deaths in a given period per 100,000 women of reproductive age. So the difference here in the ratio from rate, here the number of maternal death per 100,000 live birth, but here number of maternal death per 100,000 women of reproductive age. Okay, notice the difference. What about the epidemiology? Maternal mortality is unacceptably high, although it is markedly reduced in the last 10 years. Okay, but still we consider the maternal mortality high. and we wanted to reduce it because most of the causes can be prevented. So there is about 295,000 women died during and the following pregnancy and the childbirth in 2017. The vast majority of these deaths, 94%, occur in low resource setting, and the most could have been prevented. Which areas is the commonest as regard the maternal deaths? The sub-Saharan Africa and Southern Asia. Specifically sub-Saharan Africa, really. Both of them constitute 86% of the estimated global maternal deaths in 2017. But specifically sub-Saharan Africa accounted for two-thirds of maternal deaths, while Southern Asia accounted for nearly one-fifth. During the period between 2000 and 2017, the maternal mortality ratio dropped by about 38% worldwide. Young adolescents between 10 to 14 face a higher risk of complication and the death as a result of pregnancy than other women. That's why we should advise adolescent girls about that, about the risk of being pregnant in such age. Maternal mortality rate in low-income countries in 2017 is about 462 per 100,000 live birth versus 11 per 100,000 live birth in high-income countries. Imagine the difference, very big difference between low-income countries and high-income countries. This is, of course, related to many factors, including the preconception care, antenatal care, intranatal and postnatal care, also socioeconomic factor, and so on. So, this is an important point. This map shows you the maternal mortality global all over the world and the area which is more dangerous in sub-Saharan Africa. What is the etiology? We can divide them into two main groups, direct obstetric cause or indirect obstetric cause. The majority related to direct obstetric cause constituting about 75% may be related to severe bleeding, specifically or more commonly the postpartum hemorrhage. Also, there is the bleeding in early pregnancy like ectopic pregnancy and internal hemorrhage. Also, the antepartum hemorrhage like placental abruption and placenta previa. But postpartum hemorrhage is more common. Infection, usually after childbirth, with puerperal sepsis, septicemia, and so on. High blood pressure, like preeclampsia, eclampsia. Complication from delivery, either from the delivery itself or from anesthesia, and so on. Unsafe abortion. This is as regards the direct obstetric cause. What about the indirect one? Maybe related to cardiovascular disease or anemia or diabetes mellitus or certain infections or medical disorders, malaria, HIV, TB. How to reduce maternal mortality before pregnancy? By family planning, preconception care, planned pregnancy, correction of any medical problem before planning for pregnancy, so not to be aggravated during a pregnancy. And during a pregnancy, a good or high quality antenatal care is important. And during childbirth, skilled care during labor and delivery is important. And during puerperium, postpartum care, including postpartum contraception. And through the reproductive lifespan, abortion-related care and counseling about the risk of termination of pregnancy in unqualified settings, during adolescent reproductive health education and services for women and the families, communication, the community education is important, and raising the awareness of women about her health. Why maternal mortality decreased in recent years? Of course, we wanted to decrease more, but certainly there is decrease about 38%. Okay, so what are the causes of this decrease? Improved health of the population, change in the reproductive behavior, like smaller families, fewer very young mothers because of awareness of the woman nowadays that the marriage and the pregnancy should happen at certain time, not in too young adolescent age. So this is important. Also, fewer older mother, better education of the mother, advances in medical practice, improved antenatal care and intranatal care and the delivery services, widespread use of blood transfusion, and broad-spectrum antibiotic availability. Also, maintenance of fluid, electrolyte, and acid-base balance, improper dealing with serious complication of pregnancy and labor, advances in obstetric anesthesia is very important, and the varieties like epidural, spinal, general anesthesia, local anesthesia with drugs with great safety, increased safety of cesarean section due to well-trained surgeon, availability of blood banks, advances in anesthesia, and advances in antibiotics also. Let us go to the perinatal mortality. We wanted to discuss the definition, epidemiology, etiology, and how to reduce it. Perinatal mortality includes death between the fetal viability, which is 24 weeks gestation in some countries, and the 20 weeks in United States, 24 in UK, and the 28 in Egypt, and the end of the 7th day after delivery. So, any mortality during pregnancy after 24 weeks or after delivery within the first 7 days is considered perinatal mortality. Okay? What is the definition of stillbirth? Stillbirth, death occurring between the start of perinatal period, gestation age 24 weeks as regard in UK, and before complete expulsion of the fetus. What is the neonatal mortality? Neonatal mortality means death in the first 28 days of life. What is the early neonatal death? Deaths which occur within the first 7 days after birth. So what is the late neonatal death? Deaths occur between 7 to 28 days after birth. So what is the post-neonatal death? Death after 28 days of life, but before 1 year. What is the definition of infant mortality? Is the death of infants in the first year of life. So, perinatal mortality is defined as the total stillbirth delivered after 24th week of gestation and the total number of the first week neonatal death, regardless of gestational age, expressed as a ratio of 1,000 total births occurring in population. What is the epidemiology of perinatal mortality? The global number of newborn deaths declined from 5 million in 1990 to 2.4 million in 2019. In 2019, 47% of all deaths occurred in the newborn period, with about one-third dying on the day of birth, and close to three-quarters dying within the first week of life. Okay? So, the first week after delivery is the most important. Children who die within the first 28 days of birth suffer from conditions and diseases associated with lack of quality care at birth or skilled care and treatment immediately after birth and the first days of life. So, preterm birth, intrapartum related complications, infections, and the birth defect cause most neonatal death. But the commonest cause is the preterm birth. Please remember this. The commonest cause of perinatal mortality is preterm birth. Women who receive midwife-led continuity of care provided by professional midwives, educated and regulated to international standards, are 16% less likely to lose their baby and 24% less likely to experience preterm birth. This is noticed and reported by the WHO. Okay, let us know about some top countries as regard for newborn death in 2019. The top 10 countries, including India, Nigeria, Pakistan, Ethiopia, Congo, China, Indonesia, Bangladesh, Afghanistan, Tanzania. What is the etiology of perinatal death? The commonest is prematurity, as we said before. Then antepartum hemorrhage, pregnancy-induced hypertension, fetal malformation, incompatible with life, unexplained anoxia, or any other cause of death. Mechanical causes, death of healthy baby due to mechanical obstruction or damage during labor and delivery, or due to trauma of instrumental delivery or cord accidents, avulsion of the cord. Maternal diseases, example, diabetes, chronic renal disease, systemic lupus, renal transplant patients. Other causes include multiple pregnancy, like 20-20 transfusion syndrome, infection, RH incompatibility. How to reduce perinatal mortality. Improvement of community economic, social, and educational standard, one of the most important factors, as the rate of low birth weight or malformed baby are closely linked to adverse socioeconomic conditions. And we noticed the rate of perinatal mortality in high-income countries, how it is low, and how it is high in low-income countries. So in high-income countries, the perinatal mortality is low than low-income countries. So we should improve the economic, social, and education standards. Also support good health, good quality data, and the health information system. It is essential to attain high quality care as regard the antenatal care, childbirth care, and the neonatal care for various obstetric and neonatal conditions. And you should know that 80% of all newborn deaths result from three preventable and treatable conditions. Imagine we know that we have 80% of cases can be prevented because related to three preventable and treatable conditions. Like what? Like complication due to prematurity, like intrapartum related death, like neonatal infection. All of them can be prevented and treated. So, improvement of antenatal care through specialists for antenatal care, which should be available. Neighborhood clinics, particularly in areas of social deprivation, will encourage more frequent and yearly clinic visit. Ancillary diagnostic facilities like real ultrasonography scanning and CTG can be provided there as well. In the clinic itself, waiting time must be minimized to facilitate the visits. Midwives, nurses, and the junior medical staff need increased education and skills to cope with the existing and the new technology. During childbirth, we should give care to women, providing childbirth care according to international guidelines, sufficient standard care, including sufficient skilled staff, resources, and training, well-equipped hospital, tools like CTG, available ultrasonography, use of partogram is very important, especially in low-income countries. It's much helpful really and can reduce many perinatal and maternal mortality. Both fetal and maternal mortality could be reduced if you are using partogram. Neonatal care, sufficient standard care by skilled neonatologists, improved management of neonatal ventilation, nutrition, and infection. Thank you. I'm Dr. Ala Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University.